name's Morgan. I'm here with Katie here. I'm going to be doing my assessment with her. This is just the half assessment to her cardiac. As she walked in, I was able to see her gait. I was able to see that she is dressed appropriately for the season. Her posture is good, although some slouching. No, I'm just kidding. Other than that, though, she is good range of motion through all of her extremities. Also, she is clean, well kept, no odors. She has a good affect. She's in a good mood. Her speech is clear. She's able to hear me well, and she does eat, so that's good. Other than that, that's what you can get from coming in when they come into the exam room. I'm going to go ahead and wash my hands. And starting off, I'm going to start from her head and move down. At first, I'm going to just assess her scalp. Visually, I'm going to see if there's any masses or bumps on her head. I don't feel any of those as well. Her hair is nice and neat. It's soft. Other than that, there's no other abnormalities. She has been complaining of headaches, so that is one thing that we will focus on. She does maintain eye contact with me. She has good level of consciousness. She's alert and oriented ×4. Her facial symmetry is symmetrical, no drooping, no eye drooping, no lip drooping. She is able to smile correctly with no drooping. Also, you can tell from her scalp, you can palpate her temporal arteries, and they are 2+. Also, another thing is her temporomandibular. If you open your mouth for me and close, yep, it does that appropriately. Her sinuses, you can palpate her sinuses as well on the top and on the bottom here. Do those hurt? Okay, good. The next thing we're going to move to is her eyes. She's able to see. She does wear glasses and contacts. Do you have contacts in right now?
Yeah.
Okay. One of the things that you could do at the end of your test is do a Snellen chart. You would have her stand 20 feet away and read the chart at the lowest line that she can read. She's obviously done that before since she has contacts. Next, I'm going to do her peripheral vision by the confrontation test. So I'm going to put my hands behind you and you tell me when you see them. Okay? Just stare straight at me.
There. There. There.
Okay, good. Next thing I'm going to assess for is the 6 cardinal gazes. What this test is cranial nerve 3, 4, and 6. Okay? I'm going to move my finger and I want you to just follow it with my finger. Okay? Okay, that's good. Also, while I was assessing that, I can assess her eyes as well, her pupil reaction. I can look at her sclera and see if there's any discharge from her eyes, conjunctiva, or anything like that. She doesn't have any of that, which is good. All of the structures of her eye are good. She is well kept. No discharge, which is good. Okay. Next, I'm going to assess her eyes, her pupil reaction for accommodation and her reaction to light. If you could just stare at my nose, I'm going to shine a light in your eyes twice, okay? Okay, one more time. Okay, and her eyes are perla, which is great. Next, I'm going to examine her accommodation too. How you do this is I'm going to show you in just a second. Alright, Katie, I'm going to put my finger up. I want you to stare at it, and then when I tell you to look at the wall, look at the wall. Okay? Look at my finger. Now look at the wall. Look at my finger. Now look at the wall. And those are also equal and reactive. Next, I'm going to inspect her ears, look at her tympanic membrane to see what it looks like. Let's see. I can notice looking at her ears from the outside that there's no discharge and they are in good shape. I'm going to put this light on. Okay. I'm going to hold the pinna back and I'm going to inspect. Her tympanic membrane is pearly white. Okay, good. And that is that. I can look through both of them and see that her tympanic membrane is pearly white, which is normal, no redness and no discharge. The next thing I'm going to do is the whisper test. I'm going to whisper words on each side and see if she can repeat them back to examine her hearing. I'm just going to put my hand over my mouth and you just repeat the words, okay?
Apple.
Baseball.
Baseball.
Okay, that is that. Next I'm going to assess her nose. I'm going to have her hold one nostril and blow through and see if she can breathe through her nose. And the next one. Okay, good. Next I'm going to examine her mouth. This, you can see if her gums are any bleeding, check her tongue for any sores. Also look at her uvula to see if it is mobile or not. I'm also going to have her stick out her tongue as well. This is going to assess for cranial nerve 12. Okay, Kitty. Just open your mouth for me. Stick out your tongue. I can see that she has no sores, her gums are not bleeding. Also, I can inspect her uvula as well. I'm going to have you say ah for me. Okay. And that is good. It is mobile. Next, I'm going to assess her neck. I'm going to start up here at her jaw and work my way down, assessing her lymph nodes. I can feel that they are soft. Are they tender at all? No. No swollen. They're not swollen at all. I can also see that her neck is symmetrical. There's no shifting. I can also assess her carotid pulses, which are 2+ as well. Then you move down to her trachea and thyroid. I can assess that. It is not big or enlarged. Do you have a history of thyroid disease at all? Okay, good. Next, I can check her neck for a range of motion. I'm just going to have you move your head from side to side. Okay, up and down. And she has good range of motion there. She does not have any masses or swollen lymph nodes that I can feel or see. Okay, next thing I'm going to do is the last part of the half exam is her chest. We're going to assess her cardiac and her pulmonary. First, I'm going to look at her chest. It is symmetrical. She has even rises and falls as she breathes. Next, I don't see any visible masses, and I would palpate that more if she does have a history of breast cancer in her family. Next thing I'm going to do is I'm going to auscultate her lung sounds. You can do 3 different tests. I am going to do the whisper pectoralici, which basically I'm going to listen to her back, and I'm going to have her whisper 99 to me, and I'm going to listen. Do you mind turning to the side? Sorry. Okay, Kitty, every time I move my stethoscope, just whisper 99. Okay? Okay? And that is good as well. And then the last thing I can do is assess her heart and listen to her heart sounds. I will start at her aortic valve, move to her pulmonic valve, to her tricuspid valve, and then I will listen to her mitral valve, which is her apical pulse, and I will listen for that for 1 minute. Okay. Her pulse rate was 86. Also, you can assess her respirations, which I did, and they were 16. Other than that, that is it for the half assessment. Next time I will do the whole full assessment. Do you have any questions, Katie?
Nope.
Okay, thank you.